The newest innovation in facelift surgery is endotine application for elevation of the brow as well as the mid-face. What is that? It is a small absorbable material that we can anchor into the skull so that we can use this to elevate the brow. One of the things that we use, in addition to the cable sutures that come from Chachi Keo's ponytail facelift, which are amazing, is the drill. When you engage this into the skull and you twist, drills into the skull, creating a partial little hole. So we make a small incision here to get access to the skull. And then what we do is we come in with the drill and we engage it into the skull. We rotate this and that drills a tiny little hole right in here. Then we come in with the endotine, very, very firm, but it dissolves away after 6 months and it has tiny little teeth. And so we can lift up and elevate the brow upwards and secure it and anchor it here and here. Depending on what the patient's looking for, sometimes patients want to elevate their brow medially, you would anchor it here. Sometimes the patients want to elevate their brow laterally, you would place the endotine over here, so you'd get more of a lateral brow lift. It's amazing how you can customize this, and because we do this with the patient awake, we can be talking to them, moving them, adjusting this to get it exactly the way they were hoping to achieve it. Here's the scope. These are the two different pieces. Goes in here. You could look through here, but we have a camera that attaches to here. This is where a light source goes, and you can put a syringe on here to be irrigating this. This lifts up the tissue, and the scope gives you unparalleled, beautiful visualization. So as we come in here, we can go down and release all of the attachments here so that the brow can be elevated. And this gives you amazing visualization so that you can go down and look underneath the tissue through an incision that's no bigger than this. So these muscles here are the procerus and the corrugators, the ones that give you the mean face. We can avulse those and make them go away, just like getting permanent Botox. Or if people want to keep their procerus and corrugator muscles, that's totally fine. We can go down and all of this area gets released so that this will elevate up, and then we anchor the lifted tissue with the endotine after we've used the scope to visualize it. And then we come in with the drill to make the tiny little hole in the skull. And then we place the endotine there so that can be used to lift up and anchor and secure the brow. That's how you do the endoscopic brow lift. Thanks so much.